It's now 4 o'clock. I'd like to call to order the August 14th special call board meeting of the Richland 2 County Board of Trustees. May I please have a motion to approve the agenda?
Madam Chair,
Mr. Manning.
I move that we approve the agenda for the emergency meeting for August the 16th.
Do we have a second? Ms. Mackey, seconded.
Second.
Hello? Any discussion?
Hello?
Yes, is that Ms. Agostini on the phone? Hello?
Yes, I'm here. I'm here.
Oh, okay, okay. Is there any discussion? Seeing none, we'll call for the vote. We'll do a hand vote. Raise your hands high, please. Ms. Agostini?
I vote yes.
Okay.
I vote yes.
Thank you. Motion approved unanimously. Okay. Now we will, let me wait till we get there. Okay. We will move into our report about health and safety. Dr. Davis.
Thank you, Madam Chair. Madam Chair, members of the board, as well as those who are in attendance, our viewing public and the public in participation here in person. We'll give you an update on health and safety. I believe we are starting this update with our nurse, Dawn McAdams. I believe will provide us with some information at this time regarding our current numbers. Ms. McAdams.
Good afternoon, Madam Chair, board members, and Dr. Davis. I just wanted to give you an update of what our numbers have looked like in the past few weeks. From the time period of July 26th through August the 9th, DHEC sent us contacts, 173, between isolation and quarantine, that we then had to reach out and make sure the parents understood what that meant for their child and when they could return to school, if they could start the first day of school. From August 1st through August 16th, so today as of 3:15, we have tracked 174 employees. 33 have tested positive for COVID, 14 have been excluded due to symptoms, 18 were identified as close contacts of an employee, 89 employees avoided quarantine as a close contact because they were fully vaccinated. So truly, if we look at the close contacts, it's much more than the 18 that were identified. 14 were non-work related quarantines. 1 was an athletic related. 5 employees are home because daycares have been closed. And of all these numbers, 40 of them were our bus drivers or bus monitors. We had a positive person from an in-service, and they had 40 close contacts the way they moved together over 3 days of in-service. We have had a second person from that cohort test positive. 4 people are in quarantine, 29 are fully vaccinated, and 6 tested negative. I was doing a pilot with them for the shortened quarantine to see how difficult that is to track. On to students. 348 students have been identified and tracked since August 1st. 104 have tested positive for COVID-19. 9 students were excluded due to symptoms. 81 non-athlete students were quarantined as a close contact. 134 athletes have been quarantined as close contacts. 19 students avoided quarantine because they're fully vaccinated, and we had 1 travel quarantine. So this is with us not being in school face-to-face. The numbers may differ a little bit from our dashboard because when Libby pulls the data, we may go back in and change someone from having symptoms to being positive or being in quarantine to being negative. So they won't really completely match up. We know that masks last year worked. They helped slow the spread of COVID-19. We had no flu. I've been following numbers in our ICUs in the hospitals, including our PICU, our pediatric ICU. They're seeing a lot of COVID. It's young people on ventilators. The pediatric ICU is full of kids with RSV and COVID, as well as a mix of other things. But I just wanted you to kind of be aware where we are now and what we're facing starting school on Wednesday. Okay. Does anyone have any questions?
Questions from the board?
I've got a question.
Ms. Mackey?
With regard to the data, and I think you probably told us this before, but I'm asking, I guess, for formalities. How do you track instances of COVID? Do you rely on people reporting to you, or is it solely a self-reporting type situation, or how do you find out when people are COVID positive and how it affects the community?
Right. It's a combination of self-reporting from parents and from employees, as well as notifications from DHEC. We're getting about 20 to 40 notifications from DHEC a day. Now that the nurses are back in school, I'm able to disseminate those out to the schools for that nurse to follow up. When we follow up, we have a Google form for students and one for employees that we enter all the data, and it goes into a Google sheet that I can then sort by symptoms, by positive, negative, vaccinated, etc.
Okay.
Thank you.
Mm-hmm.
Any other board members? Okay.
Madam Chair, this is Lindsay.
Ms. Agostini?
Thank you. Thank you, Ms. McAdams, for your report. I'm sorry, I'm getting echo or feedback in here. But one I would like, if possible, she rattled off a lot of great information for us. If we could get that in writing. And then I'm also curious, she had mentioned about the PICU in the hospital. Could she elaborate a little bit more on that in terms of who are the patients and their ages, if she knows that?
I know Lexington and Richland, it is mostly people from 18 to, I think, 50 is what's been reported on the news. I don't have the exact numbers for the pediatric ICU, but I have heard reports they have been full, and they have been full with mostly COVID and RSV, as well as summer, traumas and other accidents and other students that are sick.
Ms. Agostini,
Okay,
she has provided us with the numbers in a sheet. When you return, we can either have that emailed to you, but we have the numbers. She gave, Nurse McAdams gave it to us earlier.
All right, terrific. If somebody could email that for me, that would be great. And I just wanted to comment, I spoke with an infectious disease doctor yesterday at Prisma, and he, if I understood him correctly, said they had 10 patients with COVID at the hospital, and they were patients who were older teenagers that were not vaccinated. But I just wanted to share that. And thank you, Madam Chair. I'm finished.
Thank you, Ms. Agostini. Ms. McAdams, I do have one question.
Okay.
I'm curious about the number of students that have not been vaccinated. Are we aware of that? Because my daughter is a pediatric nurse at Richland Memorial, and the cases that they're seeing, and they are full and they are increasing, but a lot of the cases that they're seeing are kids that have not been vaccinated, especially the ones that are older.
Yeah.
Now the younger ones, that is what it is, but the older ones are not being vaccinated. With these numbers right here, is there a breakdown as to who has been vaccinated? I know that that's HIPAA, but how are we tracking that?
Yeah, 19 of them have been vaccinated.
Okay.
Of the students. I will say when we held our vaccine clinic with Prisma on July 24th, we vaccinated 651 community members. 488 of those were less than 18.
Okay.
I don't have our numbers from this past Saturday. I know it was over 500 at one point, but I had to step away from the recovery area and go work on contact tracing. So I have not heard what our final number was.
Okay, well, thank you. Board, any other questions or concerns?
Madam Chair.
Mr. Manning.
Madam Chair, I have one more question.
Ms. Agostini, let Mr. Manning speak, and then I'll come back to you.
Do we have any
Thank
idea
you.
about staff and vaccinations?
I'm sorry?
Percent of staff with vaccinations?
Percent of staff, I don't have an exact figure. We did 1,600 when we did our employee clinics back in March and April. A large percentage had, I don't know exactly how many had gone. I figure we are probably, do we have about 5,000 employees? 4,000. So I would say we're probably close to 50%. Because if we've done 1,600, I know at least another 400 were going to North Carolina and other places before we did our clinic.
All right, thank you.
Okay. Ms.
Just a-
I'm sorry, go ahead, Ms.
Yeah, Ms. Agostino.
Ms. Agostini? Ms. Agostini?
Got feedback here. Can you hear me?
We can hear you.
Oh, all right. Have we thought about offering another vaccine clinic for our students at each school, for example, each high school when they return?
We have not really discussed that as yet. Going forward into the fall, we have discussed with DHEC doing their routine school-located vaccine clinic for influenza.
Okay, Dr. Davis?
Thank you.
I hate to give a percent when we don't have a percent because sometimes that gets misrepresented. And I know that's not what Mr. Manning was attempting to do. We have about 1,600 individuals that were vaccinated in our employee vaccination clinic in our partnership with Providence Hospital. We have roughly about 3,800 employees in our district. So right there, that's roughly about, I think, about 50%. So we're guessing that we had probably anywhere between 500 to another 1,000 employees could have easily been vaccinated. With us not asking directly for vaccination status, it's really difficult for us to gauge that. That's one of the reasons why it's important for us to continue to practice those mitigating strategies to ensure that we can reduce the spread of COVID in our school district. But I'm confident that we're somewhere well over 60% of staff that have been vaccinated in our school districts. In addition to the question regarding vaccination clinics with students, one of the unfortunate things here in Columbia, unlike many other places, is that our families do have a lot of resources and access to the vaccine if they choose to take advantage of that access. I think is a great question or an idea for us to continue to look at whether or not we should offer another vaccination clinic. But we just wrapped up the one we did on Saturday. And so we would need to, that does require some planning and some manpower on our staff and another partnership in order to get that done. But that is definitely something we can continue to look into. However, in the interim, there are plenty of places that are offering the vaccine should families decide that they want to get their students who are eligible for the vaccinated in this community. And we encourage them encourage them to go out, first talk to their physicians to ensure if they have any concerns, and then secondly, if there is no reason that the physician could share with them why they should not be vaccinated, to strongly consider getting the vaccination so that we can, as a community, protect our students, because we do have a population of students, regardless of whether or not they wear masks, regardless of whether or not individuals are vaccinated, that cannot receive the vaccine, and the Delta variant has proven time and time again that regardless of the vaccination or not, there have been many breakthrough cases of individuals who have already received the vaccination. And so fortunately for them, having that vaccine has really helped to lessen the symptoms of having COVID. And so I'm thankful for those individuals who've done so, and we need to continue to share that message. Thank you.
Okay. Thank you, Dr. Davis. Thank you, Nurse Adams. We appreciate that. This is a very inclusive report. We appreciate all that the nurses are doing. We appreciate everything because we know this is a daunting task. So just wanted to know that we hear you and we understand. Thank you.
Thank you.
Okay. At this time, we'll move into our executive session. At this time, I have a motion to move into executive session.
Madam Chair,
Ms. Mackey.
I move to convene an executive session for the purpose of receiving legal advice regarding Proviso 1.108.
Okay. Do I have a second? Seconded by Dr. Cheryl Caution Parker. Any discussion?
Madam Chair,
Ms. Agostini.
thank you. I just want it stated for the record that since I am driving from Chicago to Columbia right now, I will not be able to join an executive session, but it is my wish to be told when executive session is concluded so that I can participate in the remainder of the meeting.
Okay, Ms. Agostini, we will make sure that you get that information, okay? And have a safe drive.
Thank you.
You're quite welcome. Okay, at this time, any other discussion? If not, we'll call for the vote. Let's do a hand vote, please. Raise your hand. Ms. Agostini, are you
I
still
vote in the
there?
affirmative.
Okay, and unanimously, we will now move into executive session. May I please have a motion to come out of executive session? Dr. Scott? Hit your button. It's still blinking.
Is there blinking?
There it
Okay,
is.
Thank you. I make a motion that we adjourn executive session at 5:08 PM.
Is there a second? Seconded by Dr. Cheryl Caution Parker. Any discussion? Seeing none, we'll take a hand vote. Raise your hand, please. Motion passes unanimously. We will now move into voting on executive session item. May I please have a motion for our executive session item?
Madam Chair,
Mr. Manning.
I make a motion that the board authorizes the district to engage legal counsel to provide the best option and legal strategy to address appropriations budget proviso 1.108, including consulting with Richland County Council with regard to protecting the health, safety, and well-being of our students and employees.
Second.
Is there a second?
Second.
Seconded by by Ms. Mackey. Any discussion?
Madam Chair,
Ms. McFadden?
I was just wondering, Lindsay wanted to be notified. I didn't know if she's supposed to be on this part or not.
I can't hear you. Say it again.
I know Lindsay had said she wanted to be notified. I wasn't sure if we were able to get her. Okay, just checking because I remember she said.
Okay, I thought Ms.
Madam
Agostini-
Chair?
Oh, okay, Ms. Agostini, I thought that you had left the meeting. I'm sorry. I apologize. I thought that you said that you were leaving, that you were in the car driving.
Yes, and what I asked was to be, and I thank Mrs. McFadden for listening and inquiring. I did ask to be contacted, and Ms. McDaniel did. I did not hear Mr. Manning's motion, however. I was let in late.
Madam Chair, I can repeat it.
Okay, let's do it again, Mr. Manning.
So the motion is that I made a motion that the board authorizes the district to engage legal counsel to provide the best option and legal strategy to address appropriations budget proviso 1.108, including consulting with Richland County Council with regard to protecting the health, safety, and well-being of our students and employees.
Okay, and let me call for a second again.
Second.
It's already seconded
It's
by
been
Ms.
seconded.
Mackey. Okay, do we need to revote? Point of interest. We're under discussion. Okay. Any other discussion, Ms. Agostini? Did you want to say anything?
Yes, I'm just sort of trying to get a little bit of background of what we're trying to do with this.
We can't discuss that. That was discussed in executive session, Ms. Agostini. But we will be glad to inform you. We will be glad to inform you later what that discussion was.
So you're not going to let the public know what their intent is with hiring lawyers?
Ms. Agostini, we had discussed that in executive session. That's why we had executive session. It's unfortunate that you weren't able to join us today, but we will be glad to inform you about what was discussed in executive session after the closing of the meeting. If there are
Thank you, Madam Chair.
If there are no other discussions, did you have anything else, Ms. Agostini, besides that?
No, thank you.
Okay, if there are no other discussion, we'll take the vote at this current time. We'll take a hand vote, please. And Ms. Agostini, if you say your vote.
My vote is no.
Okay, motion passes 6 yes, 1 no. Okay. At this time, yes, 6 yes, 1 no. Okay, at this time, I would ask for a motion to adjourn the meeting.
Ms. Madam Chair. may I-
Yes, Ms.
May I
Mackey.
take a moment of personal privilege just to say
Yes, you
that
may.
I'm appreciative to administrative staff and my fellow board members for doing what we can to keep students and our employees safe. We all know the issue with regard to the proviso and the legalities thereof, but I know that efforts are being made to make sure that that we do what we can in that regard. And I just wanted to tip my hat to fellow board members, Dr. Davis, administrative staff who was working hard to do that.
Okay, thank you, Ms. Mackey. At this time, we will call for the vote to adjourn.
I move to adjourn the meeting, Madam Chair.
Okay, is it seconded? Seconded by Dr. Cheryl Caution Parker. Any discussion? Mr. Manning, you really ready? Seeing none, all in favor, raise your hand. Ms. Agostini, if you will vote.
Yes, please.
Okay, it's unanimous. Closing of the meeting. Thank you.